So do I
I
click OK or it's okay?
yeah, it is.
Okay.
Okay. Hi, Dr. Kois. Thank you so much for joining me on this podcast, and it's also going to be put on the YouTube. I wanted to, I mean, you are more famous than you need to be introduced, but nevertheless, there's a couple of pointers that I personally had to learn over the years. I followed you since I was a student, and you were one of the pioneers to talk about immediate implants and the depth of the immediate implants, and to say that it has to be measured in the right way from the gingival margin, along so many other things that I really learned so much from you, and so many other people are learning. You are trained as a periopros from UPenn, and you have a master's from Washington University. And you have an amazing Kois Center. It's a continuing dental education. And that's the reason we are talking today, because I want to explore what is happening in continuing dental education nowadays.
Sure. Let me chime in here a minute. I really
Sure.
appreciate your kind words, and I just wanted you to know I'm here to be here with you, and hopefully be able to provide some insights for people that get an opportunity to listen to this.
Amazing. Exactly. That's the whole point. So since we left it at your expertise in the continuing dental education, I'm somebody who's been in academia and in continuing dental education. I experienced it firsthand how there is so many programs out there, and there is a reason behind it, and that's what we want to talk about today. But let's start with why there is a need, so much need for continuing dental education, based on your opinion.
Well, obviously, your background focused on the education side in the academia world, training people to come to the outside world, so to speak. And what I'm doing is following up on the results of some of that. And that's what I think you were driving at with some of your questions, is what are the trend lines that we're seeing and what's happening. And, you know, as the center has been around for 30 years. So it's helped me, or at least allowed me to see the transition and the growth and changes that is occurring with students that are coming to the center. And what we have is maybe a unique opportunity, because our center is a graduate program for practicing dentists. So it's a full curriculum. And the reason I say that is because it gives me an opportunity to work with students and track their growth as they go through the program. And so we definitely see some changes, but I will say, in general, I know that people say things about younger dentists. We'll just start with this. But the younger dentists that are coming to the center are incredibly motivated and incredibly willing to work really hard and further their career and their knowledge and do better for patients. So I'm very fortunate, very blessed with working with people that are motivated. Otherwise, maybe they don't come to the center. I don't know. Maybe it factors that out. But I'm very excited about the future of even the young dentists, based on my perspective of what's coming to the center.
Excellent. I'm sure they are very motivated. You are in Seattle, so you have people come from all over the United States. So it's a pretty a big commitment, but they are getting something for their money. I saw the curriculum; it's really impressive. But when I look at the numbers out there that exist in the healthcare in general, there is the economy of continuing education is around $90 billion. There's no specific number for the dental part, but that nevertheless there is what I found, that dentists, the recent graduate, are been actually advised to have around 5% of their revenue reserved for continuing dental education. it's substantial for a recent graduate when they have paid $95,000 at Tech NYU, for example, or UPenn as an example. Isn't it isn't it too much after they have paid, let's say, 400,000, 500,000 on their education to pay extra within the year or two that they came out to learn more and be proficient more? Is there
Well,
a reason for that?
it's really an interesting dilemma. I certainly understand what you're saying. We hear the concerns, the pressures from the existing younger dentists that come here, but you know, these things have been in existence for a long time. The pressures of trying to work in the business, on the business, with patients, and continue to grow. There's no question that we have to create continuous improvement. The things are changing at the speed of thought. When I started after graduating from dental school, even before I went into specialty training and perio-pros, as you mentioned, I spent time in the Air Force, and my original CE was working in patients. I had a general practice residency, and so I was very early on indoctrinated to the need to continue my education and continue to train from the very, very beginning. It was not possible to continue to be competitive in this world and do the right thing for patients without improving your knowledge and your ability. Let me say something about knowledge. You know, many people don't realize the benefit of what real education does because information is cheap. Um, Knowledge is even cheap. You can Google it, but
Mm-hmm.
wisdom is priceless. And being able to assimilate a lot of the concepts and a lot of the information based on evidence-based science takes a long time to begin to process. And you know that very well, being in specialty training and working with your graduate students, understanding what the literature is saying, understanding the limitations of what we have to say and our ability to manage patients, transferring that into the clinical environment is no easy task. And I would say when I think about the younger dentists and where their liabilities are, I explain there's three things that are critical to be sustainable as you move and progress. The first one is risk assessment, being able to make better decisions uh, from from the literature, as I mentioned. The second is being able to place teeth in the face. It's an aesthetic piece that's important as we grow. And the third thing is making teeth fit together. These are the main ingredients that are sustainable. You know, bonding agents come and go, products evolve, but these major concepts are sustainable for the rest of our lives. And so I think the training has to focus and rooted in the elements of biology and management of the critical things that dentistry has to offer patients.
That is incredible, exactly what I was hoping to hear. But let's face it, in reality, there is a lot of programs out there. And I know it's difficult to ask you this question, but I know you for years that you are very man of your words and you say the way it is. There's a lot of programs. Now you are somebody who have built a real concrete studies based on you have this principle that you just said and on biology, which I love. But there's a lot of programs there that they are taught by apprentices, teaching apprentices basically, especially in the domain of dental implants. But a young fellow that comes out, he's going to be or she's going to be faced where, or I need to learn a new service to provide because I can make more money and so on and so forth. So how can you give them guidance to choose the program? Let's say not everybody wants to come, or they can't have a spot in your center. But what do they have to look for in choosing programs?
Well, to answer that question as effectively as I think I can and be fair, I don't know about a lot of other programs. I haven't, if I haven't experienced the program, it's not fair to make a comment.
Mhm.
And so what I focused on, at least, are the programs that we're responsible here at the center. And we have a full research-based system here at the center. We do our own research funded by the center. Our goal is continuing education. We have no conflict of interest with other companies, other products. So we try to stay void of any conflict of interest so we can uh, be able to move through all the complexities that we have to without being corrupted by maybe the issues that involve some teaching programs that are based on products and maybe orienting the goal of the teaching to manage the product. But it's hard for me to speak to that, having not experienced that and not doing that here. I mean, I read 28 journals a month. I'm trying to stay on top of a lot of education. We have dentists here come from all over the world, and they're pushing me. Uh, there's not a dentist that comes here that doesn't take other continuing education. So I'm constantly challenged by what they learn from other centers and what they've heard, and constantly trying to sort through that enormous maze of complexity that's out there. But the center here is we focus on a framework that's based on the the issues in organized dentistry. We're not trying to invent a new language. We're trying to stay true to the science of all the different disciplines and be fair to what they have to say. And I'm saying what I see is even when you finish dental school, maybe even the best dental school or whatever your program is, everything is changing. Even things that I've invented or maybe I've developed patents for, they're becoming obsolete also. So we all have to stay. Uh, we have to stay in this whole, let's say, the challenges of continuing to evolve. And
Mhm.
this is not so easy. And I think it's an evolving process uh, that we have to focus on more than throwing arrows at existing teaching systems because we're all one point in time and we have to continue to evolve.
Okay. It's actually a beautiful way of putting it. I never thought about it this way, so it's thank you for that. So the world of dentistry, as you're mentioning, has been evolving. Especially the digital has changed us completely, has put new pressure on us financially, and so on and so forth. Uh, New graduates are coming out with a lot of debts, and they are not able to work for their own, so to speak. So either they work for DSOs or they work for some kind of uh, other dentist, for instance. Uh, you had the luxury to build your own. I had the luxury to build my own. There's any wisdom that you can give those people that how would they navigate it? Because they need to learn. They want to prosper. They want to increase. They want to expand.
Oh, yeah, I have some input here. I think uh, because I hear these challenges, I hear the concerns, but the reality is even for business owners, it's not just about profit and loss statements. It's about survival probability. It's about being able to create longevity. Here at the center, uh, I would try to summarize a goal very simply in that in your practice, you should only receive two phone calls, two types of phone calls. Phone call number one is new patients, which is important for growth. And phone call number two is praise. If the phone rings for anything else, it's not going to be good. You probably shouldn't answer it. So my point is what I want the dentist to go back to, even the younger dentists going back to the 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 people that are running the practice or the people that are running the business, finding better ways to improve the efficiency and not have to redo things has a huge cost savings, which is not always so evident on profit and loss statement. People are losing sight of the expense of chair time and being able to understand labor capacity. And when you divert your attention to other endeavors, maybe you're actually losing money and not even realizing it. So I can't imagine why any dentist that goes back to wherever their practice situation is can't begin to make a more efficient use of their time and actually improve the practice. So we do also try to learn with a corporate or fiscal responsibility also. It's just never at the expense of the patient.
Yeah, that's the whole goal. I think that they can make better money, better income, if they want to call it this way, if they do the right thing by the patients. Which brings us to an ethical problem. So that is, if you are an employee of a DSO or whatever, again, big thing, you are teaching them to do the right thing and do the great things, but they're going to go back and sometimes they are not being able to do what they have learned and have prospered. And I know you touched on it. So can they, there's any way for them to show it to their boss, basically?
Yeah, absolutely. I think it's probably maybe a while ago, I published a little piece for the AGD. It was relating to this ethical moment controversy that we face in practice. And some of it is our inability to make precision-based, data-based decisions. They tend to be emotionally driven, and they tend to sometimes be confused with ethical improprieties, so to speak. Maybe some of it is decisions based on different levels of understanding or different levels of education or different technology. And so it's really a tricky slope, a slippery slope, because, you know, it was very easy when it's just fill a hole, treat pocket depth. It's not so simple anymore because our patients are uh, coming in with a huge range of different issues and trying to understand from one point in time the future. Because when it really comes down to it, we're in the tooth mortality business. And
Mm-hmm.
we're trying to have people's teeth outlive them. And when you start to take the long-term effect and look at the long game rather than the short-sighted piece that sometimes impacts many practicing situations, it changes your perspective. And so those of that have been in practice longer term, they see these things. They're not always reflected in all the literature, because sometimes also randomized controlled trials don't really help you make the decisions on an individual patient that has different risk factors that are showing up in the RCT studies. And
Mm-hmm.
so it's very confusing how to make a decision because at the end of the day, there's a single patient sitting in your chair that has a range of risk factors that have to be analyzed to make the best decisions. And you can't always rely on the data from, or the mean data that's developing. It's really confusing. And so my point is, sometimes the way people interpret the literature is getting confused with targeting maybe entrepreneurial agendas rather than really understanding what's happening.
Yeah, you touched on something very important today with this management software that we all have in our offices. There is a lot of data there. It's much actually. There's so much data compared to when we had it on charts, written charts. You know, I saw the both of them. I'm sure you did too. So it's important to look at your data in your office and see what is happening with your patient in the long term, and make a decision. Do you kind of focus on that in your center?
Absolutely. Actually, we pioneered systems, moving toward building software just to accomplish that.
Mhm.
And the point is trying to figure out what's actually happening. Are you looking at previous disease activity, current disease activity? What's the rate of progression of this disease? You know, for example, in school, we understand that most dentists, when they treat, let's just say, caries, and by the way, caries is the disease of the person, not the tooth. The tooth has the result of caries, which is a cavitation. So even many dentists don't realize when they treat the tooth, they treat the result of the problem, not the etiology of the problem. So
Yeah.
fundamentally, starting from the beginning, we have different issues to deal with. Putting a filling in a tooth doesn't treat the disease, it treats the result.
Yeah.
And so now when you look at the survival opportunities of that, they have to look at the whole tooth. Why did that tooth break down to begin with? Did you really manage that process with the restoration? And so as we start to build that whole algorithm for what's going to happen after we do the restoration, many dentists really don't understand that piece. They're good at restoring the tooth, but I try to explain to dentists, even single tooth dentistry, it's not simple-minded dentistry. You still have to make better decisions every day. What's the reason that you're actually treating the tooth? Did you take care of the etiology? It's a full medical model system. And
Exactly.
that's what we need to continue to provide. It's why the push is more critical thinking than just restoring things or fixing things.
And that's what I was happy to hear from you, because we lack in dentistry measuring outcomes in general from our personal practices. Forget about schools or bigger environments. They have it in medicine. They do these things. We talked about mortality
Yeah,
of it too.
even our outcomes a lot of dentists are making decisions based on surrogate outcomes, not true endpoint outcomes. It's
correct.
really
Yeah.
tricky.
Yeah, and that's where we are. Unfortunately, we're moving more into technique more than it is a medical or healthcare part of it. And so, with that, I didn't know that you served in the Air Force. So there was the
9 years.
Veteran Days. Yeah, Veteran Day recently. So thanks for your service.
Well, thank you.
I have another common thing. I served in the Army, though, not in the Air Force.
Go.
8 years. So yeah. So with 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 this, so there is a lot of schools opening out there. I know we are trying to stick to this, but there's a lot of kind of new schools, new wave of schools opening up. And in those schools, what I noticed, that they don't have any departments like we had back in the day, or still periodontics, endo, and so on and so forth. And they are mainly teaching comprehensive dentistry. And that is a trend that happened in the early 90s, even in the classic dental schools, comprehensive dentistry. Back in the days, we used to go to a department to learn from endo, from perio, from whatever. Then they moved into the comprehensive. Do you think that this model of making a super dentist is a viable and healthy thing for the outcome and for the patients in the long run?
Well, you're certainly correct. Even the dentists that are coming to the center, they are much more involved in many more procedures, many more protocols, and they are uh, starting to do bigger cases, much more comprehensive care in the majority of dentists that are coming to the center. Now, it's like anything else. As you begin to grow your skill level and improve your decision making, there's always limits that people have to begin to realize when it's necessary to refer, when it's necessary to go to someone that has more training or the better training to suit the needs of a given patient. And to some degree, I do think the comprehensive model that's kind of I see in many patients is actually helping them, I think, in the long run, make better decisions.
Hmm.
I think it all comes down to the responsibility of the person providing the care. Regardless of how much training we have, it's not realistic to go to a weekend course and think you could always perform to the level of the person giving the course just because you're sitting in the seats. It
Hmm.
takes years sometimes to develop the skill level. And I think, at least from the dentists that I work with, uh, they are they understand that. And
Hmm.
I find them very respectful of that. So I'm not seeing a problem in that regard with the dentists
Hmm.
that I work with here at the center.
So what I seen that you have something very interesting is you have a mentorship uh, program in your for your graduate. So you have people who have graduated from you, learn, they join you, I believe, and they become mentors, and then they can reach out to them and ask them for cases. Am I right? Or
Yes, in fact, I have a saying here at the center. What happens in Seattle is not meant to stay in Seattle.
things? Yeah.
So we work very hard on providing ongoing help for students.
Hmm.
And so the mentors are that missing link because they are what I call gap closers between what happens from what's on the screen or hands-on programs to what's being implemented in practice. In fact, as you're mentioning this, my son is also a prosthodontist. Um, we are putting together a program on collaboration. And one of the things that we believe is critical when you work with other specialists and you work with other practitioners, you have to work with them responsibly. You have to bring something to the table. Whereas there are practitioners that use specialists to just do things and they don't contribute to things. And that's not a collaborative environment. It's just
Right.
like the dentist that wants the lab technician to design the whole case for them and have no input. That's, I think, irresponsible. And I think when you're working with other people, you have to understand what they do as well as what you do, so that we could grow together. So we have to grow as a team. That's the piece that I think is important.
Yeah, it is. It is very important to have mentors for the people who take the courses, because not everybody can reach out to you and have all your knowledge.
Absolutely.
It's impossible. You have how many graduates around so far?
Oh, there's thousands.
Thousands. Yeah, good. Well, Dr. Kois, I like to keep them within 25 minutes or so, or 30 minutes. I really appreciate your kindness of making the time and interviewing with me. As a closing statement, what is your view for dentistry from somebody who's been in it for a lot of time? What do you
Um,
think it's going to be?
well, first of all, I didn't realize the time had gone so fast. Number one. Number two, I've enjoyed chatting with you, bringing out maybe um, many of the issues that we don't always think about unless we create an environment that allows us to think about these issues and bring these points out. So I hope listening to some of the things we were talking about is helpful. But to be honest, I'm very encouraged about the future. I know there's a lot of negative things that people bring out, but I think based on the students I work with, I'm very positive about the future and quite frankly, their future. Um, I see the reasons are I actually think we could deliver better health care today than we could years ago. We have a lot more materials that have improved what we get to do. We can do more minimally invasive procedures than we could before. I think the longevity of what we get to do is outlasting what we were able to do before. And so, from a patient care perspective and the growth of our profession, I am very encouraged about the opportunities that we have for the future.
On that wisdom, I want to thank you very much, Dr. Coys, for making the time. And it's always a pleasure to
It's
see you.
John, by the way, for
Yeah,
sure.
okay.
It's always John.
All right.
So formal,
All right.
drives me
Yeah,
crazy.
I know. Okay, John. So thank you so much for it, and I really appreciate it. I wish you a great weekend.
You too. Thank you so much. It was a pleasure. Thank
Take
you.
care. Bye bye.
Bye-bye.